What is the risk of wound infection in case of male undergoing the Hartmann procedure for perforated sigmoid diverticular disease? So it is one of the direct question. That means in case of the Hartmann procedure, how percentage it would be undergone wound infection. Here the options are 35%, 15%, 10%, 20%, and 80%. So what percentage there may be get infection? So first of all, let's see the what is the Hartmann procedure. Imagine first of all, see, this is the ascending colon, transverse colon, and descending colon. Here also there is the sigmoid colon. So what happens in case of the Hartmann procedure? So in case of the Hartmann procedure, what usually done? Usually a portion or disease portion usually is removed. That means the disease portion is removed. Then the terminal portion, it is usually closed. And what the proximal portion? Usually the proximal portion, it get exterior, and it usually done the end colostomy. So end colostomy with distal stump closure with removal of the disease segment, this is known as the Hartmann procedure. So in case of the sigmoid valvular disease, if Hartmann procedure done, then what percentage will be wound infection? And here we can see this infected. And you can see this infected case carry high risk of the wound infection, because this is the perforated diverticular case. Here this is the diverticular case, sigmoid diverticulum, and there is perforation. That means the stool, which is the infected part or polluted part, they are within the peritoneal cavity or within the pelvic cavity. So there is a high risk of development of the wound infection in a really heavily contaminated case. Some surgeon does not close the skin at all, and even if antibiotic are given in this case, the infection rate will still very, very high. So under the antibiotic coverage, also good antibiotic, but there is risk of development of the infection, and which is the 35%. So in case of the perforated sigmoid diverticular disease, when there is infected materials, fecal materials, they are from the gut with and enter in the pelvic cavity, in this condition there is a risk of or chance of infection is very, very high, and it is about 35%.